Hello everyone and welcome back to sqadia.com. Today we will be talking about menstrual cramps and its related differential diagnosis. It is a really common phenomena in the young girls these days. Well, menstrual cramps are throbbing or cramping pains in the lower abdomen. Many women have menstrual cramps just before or during their menstrual periods. For some women, the discomfort is merely annoying. So, it feels like waves of pain and aching in the lower back, abdomen, and thighs, and they usually disappear when you begin menstruating each month. So many young girls might come to you with this problem, and the questions that you need to ask them is about any episode of depression, anxiety, irritability, decreased interest in usual activities, difficulty in concentrating, lethargy or any sort of weakness, change in appetite, change in their sleeping patterns, tenderness of breasts, bloating, or weight gain. You also need to know if they have ever had any kind of ultrasound of the vagina or a biopsy of their cervix, and what those examinations showed. You also need to ask them either they're taking any non-steroidal anti-inflammatory medications such as ibuprofen. You also need to ask either they're taking any soya or herbal medications. After asking all these questions and taking history, you need to go for a physical examination. And for that, you're going to thoroughly examine their rectum and you're also going to perform a pelvic examination. So here comes the main question. What are the different types of menstrual cramps and what is the typical symptom for each? So you must remember, if the patient has several days of pain in the lower back, abdomen, and thighs, and the pain disappears when menstruation began, then the patient is suffering from dysmenorrhea. Dysmenorrhea is painful menstrual periods. And if the patient has any of these 5 symptoms of the following that include depression, anxiety, irritability, decreased interest in usual activities, difficulty concentrating, fatigue, and weakness, changes in appetite, changes in sleeping patterns, breast tenderness, bloating, or weight gain, then the patient can be suffering from premenstrual dysphoric syndrome. It is a more severe form of what is commonly known as premenstrual syndrome. And lastly, if the patient has constant pain, increasing in severity until menstrual flow becomes light, then the patient is suffering from endometriosis, which is overgrowth of tissues from the uterus. So that was all about the menstrual cramps and its related symptoms and diseases. For more such informative differential diagnosis videos, keep watching sqadia.com.